For our mentors here tonight, our first question is, what is the best way to incorporate active care with clients who only want a passive care treatment without as such disrupting the relaxing time that they probably have turned up for? This is something we would likely see quite frequently if you're going from remedial to myotherapy, or even if you are just in the remedial space and not wanting to do relaxation. How do you do that without breaking their little hearts? Sean, you had your hand up to start us off. Fill us in where, this is probably something that I have no doubt you have seen. Where have you kind of overcome that perspective in terms of a passive to active treatment?
Yeah, I think we often talk about this in our courses, the paradigm that you operate under, your teaching or your treating philosophy. What sort of philosophical approach you take as a practitioner. And there does come a time where you sort of have to make a decision about, am I a clinician or am I a technician? And the technician can do a beautiful, amazing, relaxing treatment. If you're a massage therapist, classic example, you might go to a massage therapist to relax, bliss out, go to another planet. And there's huge value in that. And there's definitely a need and a demand for that. If you want to take your treatments from that very passive to active rehabilitation programming type approach, then I think you're trying to put yourself then in the mindset in the clinical practice scheme of a clinician. And there, you sort of have to draw a line in the sand. It is really difficult to do both. If you have a business that operates and tries to be technician, therapeutic, massage, relaxation, and clinical reasoning, clinician, science-based, evidence-based, treatment planning type approach, then it's really difficult, one, to promote yourself in both camps, and very difficult for you to have a patient walk through the door and know what they're going to get. So I think if there's two things. One, decide which way you want to go. It's really difficult to do both. So pick one, whichever one feels best in your heart. And the next one is, if you've got patients, for example, who are used to you giving a very therapeutic, relaxing type session, and you want to become this more clinical thinking, progressive type treatment approach, then take the new ones that come in the door, introduce them to that style so that they don't have to relearn who you are and what you do. And then just make, this is what I do. And they'll either like it or they won't. They'll leave if they don't, and that's okay, because there's plenty of other practitioners that can help them, and there'll be plenty of other patients that you can help. So draw a line in the sand, pick one, and then start introducing your new paradigm to new patients, and then drip feed it into the old ones who you think might be open to it. And there'll be some that won't, and eventually they'll fade away, or you'll just continue doing what you were doing. But start with the new ones. That makes it a lot easier.
Yeah, absolutely. And I think that perspective of really picking what you want to be and being confident with that. Erin, did you have something to add for us in that perspective as well? Certainly, I know you've worked extensively across both of these. What's your kind of thoughts?
Yeah, and look, I agree with those strategies Sean suggested. Something that I have played around a fair bit with and have found some really good success for those patients that perhaps, like, I understand the question that you posed to be the person that comes in with a bit of an idea of what type of treatment they want, and maybe it is a bit more passive. And I've got my myotherapist hat on, and I'm like, oh, I have got some exercises for you. What I like to do is, as part of that initial chat and assessment, I sort of say to them, look, while I've got you here and while you're still upright and sitting on the table, let's have a look at a couple of the exercises I think are going to be great for you. And I give them a couple of little things. And then I'm like, great, we've kind of got that now. We've had a bit of a go. We're going to do some treatment. It'll let you chill out. And then once they're back upright again, and they might be a bit, dozy. We all know that clients aren't super reliable after a treatment. And so then if they're in that dozy state, you can sort of go, hey, remember those couple of ones that we went through at the start? I'll shoot you an email. It'll have the images. It'll have the video of how to do it, and it'll have the explanation. And that's what I want you to do over the next couple of sessions. And I think you'll find you'll feel as good as how you feel now if you keep doing those things. And I try to tie a couple of stuff together there. I try to tie that positive feeling that they've got from just having got off the table to those exercises that I want them to do. And I try to tie the whole, we'll get the stuff that you don't like out of the way first, and then you can lie on my table. So I've found that that works for some people, and I found that it empowers them because they feel like, oh, great, I have got something that I can take away that's really valuable. But for some people, they do want to come to chill out for, even if it's 20 minutes on the table. So it lets me do that. Yeah.
Yeah, nice. And I think it's sometimes combining those two and not missing the fact that sometimes a less passive treatment is still may be suitable for some portions of treatment as such for them, that they're not completely it's not a completely irrelevant kind of technique to be using at times. Steph, you've got to add for us.
Yeah, just a few quick little things that probably both Sean and Erin have already said, but I'll just reiterate, I suppose, some of my thoughts. I know in some of my experience, I've tried to target it in a way where, similar to Erin, bring things up at the start, but try to put the onus back on the client in a way where you can introduce small little things to them, whether it's at the start of the session, whether it's going from one position to another, whether it's giving them something to do at home where they realize the benefit of it, and then you incorporate that into the treatment in some way where you can reiterate those same movements or the same techniques that you've been giving your client to do at home, incorporate it into the treatment because they know they get benefit from it. Or even a progression for your clients that are a little bit more stubborn and know you as the practitioner that was passive that now wants to become a little bit more active. Pick a technique where you know you can start with some passive treatment, then progress it to that same technique, maybe adding in some active treatment, and then progress that treatment technique to get the outcome that you want. So you're not thinking, I need to go one day from completely passive to next day, not having them on the table for longer than a minute. So sort of find that treatment plan or develop a treatment plan to get you from where you are now to where you think you want to be. And there's no right or wrong in terms of length of time, I suppose, either with that, depending on you as a practitioner and your client.
Yeah, I think it's kind of, important for all of us that it's not kind of throw everything out you've ever known and you need to start again, that it really is coming back to slowly beginning to transition patients, and whether that's, adding those things at the beginning or whether it is actually picking and your new patients then have that direction. But not to completely throw everything out you've ever done, because it's all incredibly valuable. It's about picking those directions and then kind of moving with those paths.